and welcome back to Straumann Live in the Arena of Confidence at IDS. My name is Dr. Artemis Adkins, and on behalf of Straumann Group, I have the pleasure to welcome Mr. Dirk-Rolf Gieselmann, Dr. Frank Bröseler, Ms. Karin Fischer, and Dr. Bill Levine to the program to discuss Straumann's offering of next-generation dentistry intended to serve the needs of the general practitioners. Welcome to the program, everyone.
Thank you.
First, I would like to start by introducing you to my colleagues here. Dr. Frank Bröseler comes to us as a periodontist from Germany. He is also a certified dental technician and has a scientific affiliation with University of Bonn in Germany. Welcome. And Ms. Karin Fischer comes to us as CEO of RLS Global, and she has over 20 years experience in the medical device industry, and her main career was with Johnson & Johnson. Welcome, Karin.
Thank you.
Dr. Bill Levine comes to us as a periodontist. He is the founder and executive chairman of Izun Pharmaceuticals, which focuses on efficacy-driven botanical medicine. Welcome, Bill. And Mr. Dirk-Rolf Gieselmann comes to us as the chairman of the board of Institute for Molecular Diagnostics and the founder of Dentagnostics, and with 15 plus years of experience in preventive dentistry. Welcome, Dirk. Okay, so as a start, I would like to first of all thank you again for coming and begin with you, Dirk. From your experience in preventive dentistry, why is it so important to focus on prevention? And what are some innovative new technologies that are offered for this?
Well, most important is that everybody understands that the new patient, let's say, patient that is looking for keeping the teeth for a lifetime, needs different answers. Because it's not about replacement, it's about maintaining the teeth of a lifetime. And that is, in fact, not the actual situation right now. We do have a prevalence of over 50% for periodontal disease at most of the civilized countries of the world. And that even if everybody goes to the dentist at least once a year, at least here in Europe. So the question is, what happens at the dental office if there is such a high prevalence of periodontal disease? And there is no, let's say, cut and dry for oral health. So they walk to the dentist and they still have a problem, and that leads to tooth loss, and nobody wants that. Everybody wants to stay healthy for the rest of the life.
Agreed. Thank you. I said agreed. Thank you. Thank you so much for that. Dr. Levine. So as a periodontist and a researcher, you have personally seen the effect and the burden, the growing burden of periodontitis. I would like to know from your view, what's needed to effectively diagnose and treat this disease that seems to be so chronic and so prevalent?
So first of all, periodontal disease is really one of the most serious dental diseases that we know, but actually one of the most ubiquitous diseases in the entire world. Dirk mentioned that it affects about 50% of the population over the age of 35. But what the reality is of the aging population, it's actually the numbers are significantly higher than that. So orally what we're seeing is classic signs of bleeding gums, swollen gums, painful abscesses, loose and shifting teeth, and eventually possibly loss of teeth. But it's not just about oral care, it's about systemic care. What the periodontal disease has been associated with very severe life-threatening diseases like increase in heart attacks, increase in strokes, diabetes, and even Alzheimer's disease. So treating periodontal disease is critical for our oral health, but also for our systemic health. From a diagnostic standpoint, clearly we need more objective measures, but everybody who has periodontal disease knows they have periodontal disease. The gums bleed when they brush. They sometimes bleed spontaneously, they feel it, they feel the pain, they have abscesses. What they're really looking for is a better way to treat this problem than we have available to us today, and that's really what we're trying to change.
Excellent. So I actually want you to continue for me, please. You mentioned how periodontitis is a chronic inflammatory disease. You have developed a concept for conservative management, including topical and mouth rinses and things like that with botanical base. Would you please share with our audience what's perio patch and what's peri-active?
So, thank you. So, we all have friends who go to the dentist all the time and never seem to finish and are constantly under treatment. On the opposite flip side, we all have friends who never go to the dentist, barely brush their teeth, and don't seem to have any dental problems. Well, what's the difference between those two groups? Most of the population is carrying similar bacterial plaque in their mouth. But it's the inflammatory reaction of that individual person which will determine what happens. So periodontal disease is an inflammatory disease. And until now, we've been treating it as an infection, which is incorrect. So we've developed something where we can actually reduce the inflammation, promote the healing to have stronger, more robust gums, which will allow you to prevent the disease from penetrating, and reduce the bacterial burden. And by developing a comprehensive solution like that, you actually can manage this disease concretely. The perio patch is a focused high-dose topical patch applied directly on the inflammation, which will bring down the inflammation and actually repair the tissue. The periactive rinse is a topical rinse used daily for long-term care, which will also have a deep penetrating effect as opposed to the current rinses, which are simply swish and kill some bacteria. This is actually going to go into the gums and actually have an impact on the tissue. So it's a radically new idea. The patch and the rinse are both based on botanical materials, so they're natural, they can be used without any side effects, they're non-chemical, non-staining, no alcohol, so really there's no limitations basically in order to use this on a long-term basis. But the critical driver here and the critical change is reduce inflammation, promote healing, and reduce the bacterial burden, which will really allow our patients to manage the disease, keep their teeth for longer, and keep their bodies healthier.
Very nice. Thank you very much. Thank you for sharing that. I'm switching back now to Mr. Gieselmann. You pointed out earlier the importance of prevention and early diagnostics for disease prevention management in general. I want to know, you have, Diagnostics has come up with a way to test for biomarkers for perio disease called AMMP8. If you don't mind, I would like to know, this test is intended to identify at-risk patients, diagnose them, and help us manage them with treatments. I want to know if you could share with our audience a bit of background about how this test works.
Well, first of all, it's important to understand that biomarker technology now comes to dentistry and opens a new field. This is personalized medicine, because we look right into your immune system. And we can do that with 3 drops of saliva. We put them on a sample taking strip, and we process it in a so-called oralizer, and we have a result. That result will tell me immediately what's up with your health. And we can look through the saliva into your body. And that's breakthrough. And it happens now in every office. So this technology, former took 2 weeks, 3 weeks in a laboratory. Now you can do saliva diagnostics in each dental office. Yeah, it's right there. And that means out of 3 drops of saliva. And this makes every dental office if you say, a saliva diagnostic center.
Yes.
So that's the future.
Yes.
And that means you see the collagen destruction in the saliva. And that means you have an advantage in time because you do the treatment before it becomes irreversible. So if you have lost the gums, they're gone. So we can do a lot with great technologies to stop it, but first of all, we need to have access to the patient's attention. People don't know that they have periodontal disease. If we would test all the audience here, 50% will notice, hey, I'm maybe a dental person, but I'm in periodontal progression. How is that possible? Yes, because it's molecular. It comes from inside your body. It's not only plaque. There's much more to oral health. It's not cut and dry, and that's what we do. We bring this technology to everybody.
Yes, very nice. Will you please also share, so I'm a general practitioner. It needs to become part of my normal periodontal treatment workflow. Can you tell me from your perspective how this gets incorporated into a regular dental practice?
That's very easy. Every walk-in comes normally for 3 reasons. Either it's pain, aesthetics, or for a checkup. 70% is checkups, and those we just take the saliva while he's waiting, and until he sees the doctor already sees a written result, a report, and the doctor knows where the journey is going, and he can show it to the patient, it's like a red light. And that's how easy it is. It is rocket science, but made easy.
Good, I like this. Yesterday we had a conversation about how the BLX was the Ferrari with big wheels. Now we have a rocket. Hey, this is good. We're moving in the right direction. Thank you so much. Now I want to switch gears for a minute about caries, because it affects about half of the world's population. So Dr. Bröseler, from your experience, you have also hinted at our conversations before about the importance of prevention and early diagnosis. Of course, this also applies to caries. So I want to know, you were a lead investigator in 3 clinical trials for caries-solve repair. I would like to know a little bit more, if you would share, as caries-solve repair, what it is for a less invasive approach to treating white spot lesions and early caries lesions, if you don't mind sharing that with our audience.
First of all, let me say that our point of view was to try to get a more focused therapy on caries and to do it earlier than before. We are focusing on very early caries. It's the first stage of caries where we see first demineralization, and we go for therapy. At that point, we don't wait until we will see cavitations or breakdowns. And the current treatment is just waiting, drilling, filling. And I think our patients, they want to keep their teeth untreated if we can provide this. And now with periodontal repair, I think we can provide this. We did prove it, and we had it in the RTCs. I have one clinical trial in our office where we compared the so-called gold standard, which is fluoride, on first demineralized teeth, and on the other hand, we tried periodontal repair as a treatment medium, and we saw that we were very much more successful using periodontal repair instead of fluoride varnish.
I actually want, if it's okay, let's continue on that topic. I want to know, first of all, if you can briefly describe how periodontal repair actually works, and I want you to expand a little bit on the greatest benefits compared to widely used fluoride varnishes. Can you expand on this a bit more?
Well, there's a totally new working mechanism. It works by so-called self-assembling peptides. Self-assembling peptide is stuff you can put on in just like a drop, just like a liquid on the tooth surface, and it goes underneath the surface into the subsurface, and then folds up, and then induces real regeneration of the enamel.
Very, very nice. Now, I mentioned earlier to Mr. Gieselmann, and I'm challenging you with the same concept, with the same question. As a general practitioner, I have to have these things fall into my normal treatment workflows, because at the end of the day, I have to train everybody and it has to work. I want you to share with our audience how you see this falling into the regular caries management workflow of a general practice.
It's very to implement it in the normal practice business, because you do your normal diagnostics, maybe just clinically, visually, or by several devices you can use for caries diagnostic. And if you are in let's say in duty to inform the patient, you can show him, and you can explain very easily how to manage this problem without any invasive dentistry. What he's afraid of, what is drilling, okay, and you don't need any drilling anymore.
I can tell you from a general practitioner's point of view, no patient ever wants to be drilled on, myself included. Thank you very much. Yeah. Now I'm going to switch gears for a minute. I want to hear from Ms. Fischer about more severe disease management for caries. So as RLS Global, you guys have developed a chemomechanical treatment for caries management to support the traditional treatment workflows. First of all, do you have a filling yourself?
Yes.
Dental filling yourself?
Yes, I do, unfortunately.
Is this why you went into this?
No, actually not. Yes, I have some experience, both as a kid and as an adult. And I was treated by the traditional procedure, drill and fill. Neither myself or my dentist had any knowledge or experience about other options to take care of your caries issues.
So you have a unique perspective. You know, I come as a general dentist, I have my perspective on caries, but because you come at it from the other side, you have unique perspective. I wanted to know from your background as CEO of RLS Global, can you share your view on how we currently manage caries?
So I believe the future is minimal invasive treatment. The philosophy is all about to prevent as much of the healthy tissue as possible, and also to prevent, future secondary indications. I think all patients should actually have a dialogue with a dentist and say, hey, is there any other way you can treat my caries issues than just drill and fill? And as you mentioned, we have a product that we have developed called CarieSolve.
Yes. Would you mind if you, would you continue on that, expand on that? What is CarieSolve? And in your perspective, obviously it benefits anyone with caries, but who do you think would be a uniquely suitable patient base for this?
But as you mentioned, it's part of a chemomechanical treatment.
Yes.
And it's a gel that you apply in the cavity on top of the caries. And what the gel does, it dissolves the necrotic dead tissue. And with an instrument or bore, you remove or you scrape off the caries. It does not affect the healthy tissue, that stays intact, and it prevents removing more tooth substance that's actually necessary. And it's eco-friendly. This product can be used to any patient, but if I was new to this procedure, I would start with ancient people or children, because what you're offering is a treatment with less pain. And I don't think any kids today actually be treated by drill and fill, because that can give bad experience that would have a major impact on their oral health in the long term.
I dream of a day where we can just take
You
the
just
drill
wait. You just wait,
and
and we will.
throw it away. I always used to say in my practice to my patients, we send people to the moon, and I still take this drill, and I still drill the old-fashioned way.
You
So
call
I
me.
dream of this
Yeah.
day. Thank you. Okay, one more thing. I remember CarieSolve from about 15 years ago. It's not a new product. I want to know what's new about current CarieSolve. Would you mind sharing a little bit?
Yeah, you're right. CarieSolve was actually launched more than 15 years ago, and there has been some product development taking place during the years. First of all, the concentration is changed. We have a higher concentration, which minimizes the time to dissolve the dead or the necrotic tissue. Also, you do not have to mix the two components. It's already taken care of. And the product itself has also have a product development upgrade. So you as a dentist will get a completely different experience by using CarieSolve today. It's much more user-friendly.
Very nice. Now we have a few minutes left, and I wanted to see if I could ask each of you to share just a few words, a couple minutes, on what you see as the future of preventive dentistry, starting with Mr. Gieselmann.
Well, everybody knows that things are changing right now dramatically fast. So the prevention patient is a different patient. It's not the same that comes in for full mouth reconstruction. You can see that. You're a dentist. Do you want to have an implant? Maybe
Not necessarily.
you want
If
to.
I have to, I want a Straumann one, but
so
if I don't have to.
Yeah, of course, Straumann is the best company, but Straumann is not only the best company if you look at, restoration.
No, I agree.
Straumann had the idea that the customer of the future is the prevention patient, because
Yes.
you go to the office to not lose your teeth, to keep them, but the track record of dentistry is bad. In Germany, if you go to the dentist one time a year, when you're 65, 12 teeth are gone. So of course you didn't extract them yourself, yeah? But the nowadays customer has a fitness tracker, he eats biofood, organic food, and he wants to maintain his teeth for a lifetime. You need to have a biosensor system to tell you what's happening in this second, not the destruction of the last 5 years that you overlook because you just have an X-ray. If molecular diagnostic happens in every office, you see what happens today. So that gives you a time advantage in treatment of 5, 6, 7 years.
Yes.
So you can stop the disease, your patients stay healthy, they get what they want, they will keep their teeth, And you are a dentist that not only looks at dental issues, because we look into your body. You can even see if there's other disease coming up.
Yes.
Yeah, so that's, in my view, what the future is. And therefore, you need to prepare. And Straumann had just a great idea to be, as a market leader, the one telling people, hey, something is changing, be aware, and here you get the right technology, scientifically approved, real scientists. You know, we have 270 studies, so there's no question, does that really work? Well, there's 30 years of research. So this is good, and Straumann takes the lead. And because Straumann takes the lead, many will follow. And everybody who listens carefully today will learn and has a big advantage because you know it before all the others know. So that's, in my view,
You know what? I
what's it.
really appreciate what you're saying, because given a choice to go anywhere in the world to apply my time as a professional, this was the company I chose, because not only the legacy of Straumann is, of course, in the implant systems. It has 60-something years of history in this. But what I really loved is hearing and joining the team and hearing that Straumann is focusing on how should we prevent disease, how should we treat disease, and how should we maintain patients afterwards. And I also want to kindly challenge you a little bit in the comment about patients and disease prevalence. I was part of human care for 15 years. It's not always so easy because patients don't always do everything to help themselves either. We all do. But what I really like about prevention is the more engaged we make patients, the more likely we are to help them help themselves, and we help them as well. So just to challenge a little bit about the clinical experience of people come and they do things that they shouldn't.
Straumann took together a great portfolio of great regenerative and preventive products.
Yes.
But you need to have the attention of the patient.
Agreed.
You need to be able to select and screen the right patient. That's what we do. But we open the door for a gigantic regenerative market that is 3 times bigger than the implant market.
Agreed.
Also for each office. That's important to know.
Thank you, Mr. Gieselmann.
You're very welcome.
Okay, now I want to switch.
Just let me say a word.
Oh, hold on.
Yeah, sorry, but I
Dr.
agree.
Bröseler, go
I
for it.
agree totally.
Yes.
And I would like to say that, for my opinion, prevention is a win-win situation for the patient and for the dentist and for a company like Straumann. Okay, we have a win-win situation, and every patient likes to have his teeth healthy in all over his lifetime. And like you said, everybody in Germany, and it's a pity, has lost 10 teeth up to his 60th year. And we can change that. We can change paradigm. And we have now the structures, and we have several new therapies like the coronal repair we can use in a stage where we never could use anything before.
Very nice. Thank you. Okay, sorry. Coming back to you guys now. Dr. Levine, from your perspective, what's the future of prevention for dentistry?
As a clinician, I think the greatest pleasure I get is not having a successful surgical procedure with a short-term clinical outcome. It's seeing that same patient come back 10, 15, 20 years later where everything remains stable and healthy. And that's one thing. And I think most dentists will feel the same way.
Yes.
And the same thing is, if I can treat a case with less treatment, then I'm happier for the patient, because
More
sometimes
conservative
it's
care,
me who needs the
customized
care.
individual care.
The thing is, though, that all dentists and the care that we give is really not driven to prevention. It's always been driven to treatment. It's a time issue, it's a cost issue, it's a lot of different issues, but the patients there needs help. But we've already abandoned preventive care to the consumer care products industry, which was a mistake. We need to take control over that again. So what we really did is, when we designed our products, for example, they have to be comfortable for the dentist to use in his own dental workflow, but critically, they have to be able to be activated by the patient at home.
Yes.
So in a sense, it's using the patient's desire. He came to you, he came for care, using the patient's interest in having the work that you did for him remain stable and healthy for the rest of his life, because he paid a lot of money for it, to give him the tools to allow that to happen. So that's really what prevention is, partnering between the dentists and the patient, so they
Yes.
have 365 days a year care.
Very, very nice. Thank you, Dr. Levine. Ms. Fischer, from your perspective, what's the future
Well,
of prevention?
I think I already mentioned it. I mean, I strongly believe in the minimal invasive treatment philosophy where you actually keep as much of the healthy tissue as possible.
Yes.
But I want to come back to what I think the gentleman just said before, that, I think the patient will be much more demanding in the future. They will ask for new ways to take care of their caries issues or other problems. And I think it's important that the industry I represent, but also that the profession together drive the science forward to really meet the needs within minimal invasive treatment.
Very nice. Thank you, Ms. Fischer. Okay, so on that note, I just wanted to share a personal comment that from a perspective of a clinician, a general practitioner, I have been very, very supportive and very excited for Straumann's approach to next generation dentistry to help us help our patients prevent disease. On that note, I wanted to congratulate my colleague, Dirk. Hello, thank you, he's here. And from the arena of confidence, on behalf of Straumann Group, I wish you well. Please come and check out the booth if you're at IDS so you can get to know our products better. I look forward to seeing you and thank you very much. Auf Wiedersehen.